Ever get handed one of those really dense medical reports, and you're left feeling like you need some kind of like secret decoder ring
Yeah,
just to make sense of it all.
I know what you mean.
It's all jargon and abbreviations.
Yeah.
It can be pretty tough to figure out what's actually going on.
Yeah.
That's exactly what we're doing today. We're going a deep dive into the world of medical reports.
Hmm.
Going to peel back all those layers and really try to understand, what makes these things tick.
Sounds good.
We'll explore how they're structured, the language they use, and even the psychology behind these really important documents. And a big thank you to London Heartbeat Z Academy in the UK for giving us the foundation for today's deep dive.
Absolutely, yeah.
If you want to stay up to date on all their incredible educational content, be sure to check them out: Facebook, Instagram, Spotify, and YouTube.
Yes!
You won't want to miss out on future discussions like this one. So to get us started, can we maybe break down the framework of these reports? What are the main types of medical reports that people should be familiar with?
Right. Well, there are many, many different types of medical reports, each with its own purpose and structure. But today we're going to be focusing on what we call the Big Four.
Okay.
These are the reports that really form the backbone of a patient's medical record.
Okay.
And those are the history and physical examinations,
Okay.
consultations,
Okay.
operative reports, and discharge summaries. You can kind of think of them like the key chapters in a patient's medical story.
I like that, like chapters in a story. Yeah, so each report is like telling a different part of the story,
Exactly, yeah.
contributing to the overall picture of the patient's health.
Exactly.
All right, so let's start at the beginning. The history and physical examination, also known as the H&P. Why is this report so important? What makes it unique?
Yeah. You can kind of think of the H&P as like the opening chapter of a patient's medical story. It's the first document that gets added to their record, and it provides that really foundational understanding of their condition. This report is super crucial, even in emergencies, because it gives you that snapshot of the patient's health at that moment. It's kind of like, when you meet someone for the first time and you want to know their background. It's the same thing with this.
So it's like laying the groundwork for everything that comes after.
Exactly.
Okay, and just like first impressions, right?
Yeah.
I imagine the level of detail in an H&P really depends on the complexity of the patient's case, right?
Oh, absolutely.
Yeah.
Absolutely. A simple case of the flu, wouldn't need the same level of detail as someone presenting with multiple chronic conditions or a complex medical history. So the length and the complexity of the report, it's tailored to each individual patient's needs.
That makes sense.
Yeah.
Now, what are the key sections within an H&P? Where does the story begin?
Well, usually the H&P will start with the chief complaint. And this is that very concise statement that captures the patient's primary concern. It's often in their own words. So it's really the patient's voice, front and center, telling us what's bothering them.
Okay, so it's the patient's voice. What comes after that?
Next, we move on to the history of present illness, or HPI. And this is where the story really starts to unfold. The HPI expands on that chief complaint by providing this really detailed narrative of the patient's current problem.
Oh, okay, so we're digging deeper here.
Exactly, yeah. You're gathering information, trying to understand the full scope of the issue.
I imagine that this information can come from a variety of sources, not just the patient.
Absolutely. Absolutely. It can come from the patient, their family members, previous medical records, or really any other relevant source. You're piecing together the puzzle to try to get a complete picture of what's going on.
Oh, that's fascinating. It's a real collaborative effort to understand the patient's present illness.
Exactly, yeah.
Now, what about the patient's past? Does the H&P also delve into their medical history?
Oh, absolutely. After the HPI, we move on to the review of past history. And this section is all about exploring the patient's medical past, So uncovering any previous illnesses, injuries, surgeries, treatments, anything that could be relevant to their current condition. You're basically looking back through their medical scrapbook to see what experiences have shaped their health journey.
Wow. So, like, what specific categories of information would be included in this review of past history?
Yeah. So this section is usually broken down into several subparts. We have the past medical history, and that covers all illnesses, injuries, and treatments that the patient has received, excluding surgeries.
Okay.
So it's a timeline of their non-surgical medical experiences.
Okay.
And then there's the past surgical history.
Right.
That's a separate section where we document all the past operations and procedures that the patient has undergone.
Got it. So we're building this detailed picture of their surgical experiences as well. What about family history? Because that can be a really big factor in, understanding the risk factors for certain conditions, right?
Oh, absolutely. Family history is a really essential part of the review of past history. It helps assess the patient's predisposition to certain conditions based on their family's medical history. So you're looking at their family tree through a medical lens, and you're trying to identify, are there patterns here? Are there potential risks?
So we might see that heart disease runs in the family, or there's a history of diabetes.
Exactly, yeah.
That's really valuable information.
It is.
Okay. Now, what about their lifestyle? Are those explored in the H&P as well?
Yes, that's where the social history section comes in. This part delves into the patient's lifestyle and personal habits to provide context for their overall health.
So this is where we learn about things like occupation and living arrangements,
Exactly, yeah.
exercise habits, diet, alcohol or tobacco use.
Exactly. Trying to understand their context and how it might contribute to their condition. For instance, if somebody works in a coal mine, that might be relevant if they're coming in with breathing problems.
That's a great example. We're not just looking at symptoms,
Right.
we're looking at the bigger picture of their life. Now, after we've looked at their social history, what comes next?
Next up is allergies, and this is, crucial for patient safety. This part of the report documents any known allergies, especially to medications.
So we're looking for any substance that could trigger a bad reaction.
Exactly, yeah.
And what if they don't have any drug allergy?
Even if they don't have any allergies, it's still important to document that. So the report would say no known drug allergies.
Got it. Better safe than sorry. Now, let's talk about medications. What kind of information is usually included in that section?
Yeah. The medications section lists all the medications the patient is currently taking. And that includes, prescription drugs, over-the-counter meds, vitamins, supplements.
So we're getting the full picture of everything they're putting into their body,
Exactly.
essential to understanding any potential interactions or side effects.
Exactly.
Now, what about their overall health? Does the H&P look beyond the specific complaint and assess their general well-being?
Yes, absolutely. That's where the review of systems, or ROS, comes in. This is like a systematic inventory of potential symptoms that they might be experiencing, organized by body system. It's basically a head-to-toe checklist to make sure that, nothing's being overlooked.
Okay, so it's comprehensive. It goes beyond just the issue that brought them in.
Exactly.
Are there specific categories within the ROS?
Yeah, it's typically divided into categories based on the different body systems. You have cardiovascular, respiratory, gastrointestinal, and so on.
Okay, so we're really getting this detailed picture of their health. Now, I'm curious about the physical examination.
Yeah.
What's the purpose of that part of the H&P?
The physical examination, or the PE, is where the doctor really gets hands-on. Literally. They're gonna observe and record specific details about the patient's physical condition.
So it's a combination of observation and
Yeah.
then feeling and using instruments
Right.
to assess their physical state. Is it organized in a specific way?
Yeah, usually it's structured with subheadings for different body systems, just like the ROS,
Okay.
to make sure everything is covered systematically.
So we're going through the body, system by system, gathering data about their condition.
Yeah.
Are there any particular subheadings we should know about?
One that's often included is general, and this section just gives an overall impression of the patient's appearance and demeanor.
Okay.
So details about their posture, their facial expressions, any noticeable physical characteristics.
So again, we're not just focusing on one specific symptom, right?
Yeah.
We're getting a sense of their whole physical and mental state.
Exactly, yeah.
It's a very holistic approach. Now, what about things like lab results, imaging findings, or other evaluations? Where do those fit into the H&P?
Yeah, that's all included in the diagnostic studies section. So here's where we bring in the data, the objective data from those tests, blood work, x-rays, CT scans, MRIs.
Right.
And that all supports the clinical observations that were made during the physical examination.
So we're corroborating the findings with data.
Exactly.
Okay. And finally, we come to the assessment and plan section. What happens there?
Right. So the assessment and plan, also called the A&P, this is where the physician analyzes all the information that they've gathered, and they formulate their assessment of the patient's condition and come up with a plan of action.
So this is the culmination of all the information.
Well,
The
yeah.
physician is trying to make a diagnosis.
Right. And determine the best course of treatment.
But it's important to remember this is happening at the very beginning.
Exactly. Yeah.
So the assessment and plan might be provisional.
It might be, yeah.
Yeah.
Meaning they might not have all the information yet to reach a definitive diagnosis.
Okay.
So they might list possible diagnoses or outline symptoms, in areas that need further investigation.
Okay, so it's like a working hypothesis.
Right.
Subject to change as they gather more information.
Exactly. And the plan might include things like ordering more tests, referring the patient to a specialist, or starting some kind of treatment based on that preliminary assessment.
This is incredibly insightful. I'm starting to see how these reports aren't just these static documents, but they're really dynamic narratives.
Exactly.
They reflect the patient's journey.
Exactly. Each report tells a part of the story, and together they create this really comprehensive record of the patient's medical experience.
Now, before we move on to the next report, we have to acknowledge the amazing work of London Heartbeats Academy UK.
Yes.
They have really provided a wealth of information for this deep dive, so be sure to subscribe to their channels, Facebook, Instagram, Spotify, and YouTube.
Yes, absolutely.
So you don't miss any future discussions like this one. Now, let's delve into consultations and see what those reports can reveal.
Okay, so we've talked about the H&P, which really lays that foundation for the patient's medical story. But sometimes things can get a little more complicated.
Yeah.
And we need to call in the specialists.
Right.
That's where consultations come in.
Okay, so it's like bringing in a detective consultant,
Exactly.
to crack a really tough case.
Exactly.
What makes these reports different from the others?
Well, consultations provide that specialized perspective on the patient's condition.
Yeah.
It's like getting a second opinion from a real expert in that particular field, and they can offer really valuable insights that the primary physician maybe didn't consider, and that can sometimes lead to a more accurate diagnosis or even a more effective treatment plan.
So we're adding their expertise to the investigation.
Exactly.
Why are these consultations so common in a hospital setting?
Hospitals often deal with those more complex cases, and specialists are readily available there on site. Imagine a patient comes into the ER with chest pain.
Right.
The ER doctor might call in a cardiologist for a consultation just to determine if the patient is actually having a heart attack.
Makes sense.
Or if a patient's admitted with severe depression, you might consult a psychiatrist to assess their mental state and recommend a treatment.
Right. In those situations, you want the best possible care.
Exactly.
And specialists bring so much knowledge.
Absolutely.
Now, what about the format of these consultation reports?
Yeah.
Are they similar to the H&P?
They share some similarities, but there are also some key differences. Consultations can be written in a couple of main formats. You have the block style and the letter style.
Okay.
Block style is more like a formal report, kind of similar to the H&P with those distinct sections and headings.
Right.
Letter style is more like a personalized letter,
Yeah.
It's often used for outpatient consultations where the specialist is communicating directly with that referring physician.
Got it. So a little more flexibility in the presentation.
Yeah.
Regardless of the format, are there any key sections we should look out for?
Absolutely. Just like the H&P, we need to know who the key players are.
Right.
So consultation reports always start by stating the patient information, the date of the consultation, and the names of both the referring physician and the consulting physician.
Got it. So we know who called in the consultant and who's providing that expert opinion.
Exactly.
What comes after that?
Then we have the reason for consultation, which is essentially the same thing as the chief complaint.
Okay.
It answers the question, why is the specialist being consulted?
Right.
In a very concise way.
Okay.
It's like the referring physician saying, hey, this is what I need your help with.
So it's very clear, very focused.
Exactly.
Okay. What comes after the reason?
After that, we go into the details of present illness. This is also sometimes called the history of present illness or the history of presenting illness.
Okay.
And this section summarizes the patient's current problem in more detail, kind of building upon what was reported in that initial H&P.
All right.
But it also includes any new information the consultant has gathered, from their own exam and assessment.
So it bridges the initial assessment and the specialist's evaluation.
Exactly, yeah. You're bringing it all together.
Okay. Now, what about the review of past history?
Yeah.
Is that section as detailed as in the H&P?
It can be,
Yep.
but a lot of times there's some overlap with the info already in the H&P.
Okay.
So to avoid repeating things, the consultant might just say, please refer to the patient's chart.
Wait, to streamline it.
Exactly. And then, for a full review of their past medical history, they can just look at that.
Okay, so we're not being redundant.
Right.
And what about the patient's current symptoms? Are those documented in the report?
Yeah, so there's a current symptoms section. It's sometimes integrated into the review of systems, and it really focuses on the symptoms that the patient's experiencing at the time of the consultation.
Okay.
So it's more targeted, honing in on those concerns that are relevant to the specialist.
Got it. narrowing that focus.
Exactly.
What about lab results or other findings? Are those in the report too?
Yes, absolutely. We have the laboratory and diagnostic section, and it summarizes, the results of any relevant tests.
Okay.
And this can be placed before or after the physical examination section, depending.
Okay.
But it's there.
So we're bringing in the hard data.
Exactly.
Now, what about the physical examination section? I imagine that's pretty important.
It is. But unlike that comprehensive physical exam in the H&P, this one is usually more focused.
Okay.
The consultant will likely just concentrate on the, body systems or areas that are directly relevant to their specialty and the reason for the consult.
So if the consultant is a neurologist,
Right.
they would focus on the neurological exam.
Exactly, yeah. It's about tailoring it to the specific needs.
And lastly, we have the impression and recommendations sections.
Right. This is where the consultant gives their expert opinion.
Okay, so they lay out a course of action.
Exactly. In the impressions section, they summarize their assessment, often including a diagnosis or maybe a list of possible diagnoses. It's like saying, based on my evaluation, this is what I think is going on.
And then the recommendations section outlines the next steps in their care.
Exactly. They might recommend more tests, medications, therapies, even surgery, depending on the situation.
Okay.
Lifestyle changes, maybe a referral to another specialist.
Right.
It's all about giving a roadmap for their continued care.
This is fascinating. I can really see how these consultations add a layer of depth,
Yeah.
It's like using a specialized lens.
Exactly. Yeah, it's all about enriching the patient's care with that expert knowledge.
Before we go on to the next report, let's remember our friends at London Heartbeat Seeds Academy in the UK.
Absolutely, yeah.
Their dedication to medical education is amazing.
It is, yeah.
So check out their channels on Facebook, Instagram, Spotify, and YouTube for more great content.
Yes.
You won't be disappointed. Now let's talk about operative reports
Okay.
and see what happens when a patient goes under the knife.
So we've covered the H&P, which kind of sets the scene, and consultations where we bring in those specialists. But what about when a patient actually needs surgery? That's where operative reports come into play.
Okay, so now we're in the operating room. Things are getting serious. What makes these operative reports so unique? And why is accuracy so important?
Well, you can think of an operative report as like a surgeon's logbook,
Yeah.
They document every single step of a surgical procedure with incredible precision. And it's crucial to have this clear and accurate record of what happened during surgery for a few reasons.
Like what? Why is that level of detail so important?
Well, first and foremost, it's for patient safety. This report serves as a reference for any future medical care, so everyone involved in the patient's care understands exactly what was done.
Right, so if there are complications later on or they need follow-up care, doctors can go back and see exactly what happened during the surgery.
Exactly. It's also super important for medical billing and coding
Okay.
to make sure that hospitals and surgeons are reimbursed properly for the procedures.
Right. So there are administrative and financial implications as well.
Absolutely. And of course, these reports are also really important for legal purposes.
Yeah, I can imagine.
If there's ever a question about the care that was provided, that operative report becomes a legal document.
Wow. These reports really do carry a lot of weight.
They do.
No wonder accuracy is so critical. So let's break it down.
Okay.
What does a typical operative report look like? Where does this story begin?
Just like the other reports, it starts by identifying the key players involved. So the report will clearly state the patient's information, the date of the surgery, and the names of all the medical personnel who are involved.
Okay, so we'd see the surgeon, any assistants, the anesthesiologist, anyone who played a role.
Exactly. And it's standard practice to omit periods in those professional designations, like MD and PA.
Oh, okay, so it's Dr. Smith, not Dr. Smith.
Right.
Got it. What comes next?
Next is the procedure performed section, and this is where they list the specific surgical procedures that were performed.
So if they did multiple procedures in the same surgery, they'd all be listed there.
Exactly. And it's also important to note that any abbreviations or acronyms in this section need to be spelled out completely.
Okay, so no shortcuts when it comes to describing the procedures.
Right.
Got it. What about anesthesia? Is that in the report?
Yes, usually right after the procedure performed section, you'll have the anesthesia section. It's usually pretty brief, and it just specifies the type of anesthesia that was used and the name of the anesthesiologist who administered it.
So it might say something like general anesthesia administered by Dr. Jones.
Exactly. Or it might just state the type like local anesthesia or epidural.
Okay. Now, what about the reason for the surgery? Is that explained in the report too?
Yeah. Yes, that's covered in the indications for procedure section.
Hmm.
It gives a brief summary of why the surgery was necessary, what medical condition or problem led to the decision to operate.
So it's justifying why the patient went under the knife. Okay, what comes after that?
Then we move on to the findings section. This is where the surgeon documents what they observed, about the anatomical structures they saw during the surgery.
Wow, so they're really peering inside the body.
They are.
And I imagine these findings can be pretty detailed.
Oh, they can be, especially in complex surgeries. They might describe the size, shape, color, condition of the organs or tissues, anything abnormal, any areas of concern.
So we're getting a very visual description here.
Exactly.
Okay, what comes after the findings?
Next up is the heart of the operative report, the description of procedure section.
Okay.
This is where the surgeon gives a step-by-step narrative of the entire process, from the first incision to the final wound closure.
This is where we see the skill of the surgeon,
Absolutely.
really describing how they performed the surgery.
Exactly. And accuracy is paramount here. The surgeon's words have to be transcribed with absolute care, capturing every single detail.
I can imagine that transcribing these reports must be incredibly challenging.
It is. It requires a high level of skill, attention to detail, and knowledge of the terminology.
Right, of course. So we've got this very detailed description of the procedure. What comes next?
Well, after that step-by-step account, there are a few more sections that provide additional details. One of those is complications.
Oh, it doesn't sound good.
Well, it's not always bad news, but it's important to document any unexpected events or challenges that came up during the surgery.
So this is where they highlight any deviations from the plan.
Yeah, exactly. It might be things like excessive bleeding, difficulty accessing an area, or unexpected anatomical variations.
Okay, so we're getting the full picture,
Right.
even the bumps along the way.
Exactly.
What about blood loss during the surgery? Is that in the report?
Yes, typically you'll have the estimated blood loss section. It gives a rough estimate of how much blood the patient lost.
Which makes sense. It's important for monitoring their recovery.
Absolutely.
Now, what about drains? Are those mentioned?
Yes, if a drain was placed to remove fluids, it will be documented in the drains section, specifying the type of drain and the location.
So we're getting a clear picture of all the steps involved. What about hardware and implants?
If the surgery involved any hardware or implants, like a pacemaker or an artificial joint, those are detailed in a separate section as well, with information about the device, the manufacturer, and the location where it was implanted.
So we have a record of anything that was left inside the patient's body.
Exactly.
Okay. Now, what about tissue samples?
Right. When tissue is removed, it's often sent to a pathologist for examination.
Okay.
The operative report will list any specimens that were removed, the location, and the tests that were ordered.
So it's like sending evidence to the lab.
Exactly.
Okay. Finally, let's talk about wound closure.
Yes, the grand finale. The operative report will describe in detail how the surgeon closed that surgical incision.
And I imagine there are many ways to close a wound.
You're right. It could be sutures, staples, surgical glue, and the report will specify what was used and any other details, like the size of the sutures.
Okay, so very specific. And with that, the surgery is complete.
And the operative report is finalized.
This has been an incredible journey, really.
It has.
The detail involved in these reports is amazing.
Absolutely. And it's so important, for the patients, for the billing, and for any legal matters that might come up.
Well, this has been an incredibly fascinating deep dive into the world of medical reports, from H&Ps to consultations to operative reports. And of course, we couldn't have done it without the help of London Heartbeat's V Academy in the UK.
Absolutely not.
So once again, a big thank you to them for all the resources and information they provide. Be sure to check out their channels on Facebook, Instagram, Spotify, and YouTube. You'll find lots of great content there. I'm sure you'll be just as fascinated as we were. Thanks for joining us on this deep dive. We'll see you next time.